My name is Marcellus Rose III. I'm a licensed clinical social worker. I guess in the different roles that I have, I'm a mental health specialist, I'm a psychotherapist, and yeah.
I'm Cherokee Bailey. I'm 19 years old.
So I'm Matthew Bell, marriage and family therapist, but I also work for BAM Becoming a Man program, run the program at the Sullivan High School.
I am Isaac Smith, currently 19, and I am at Wilbur Wright College.
Yeah, I do think it is. Mostly because of like visibility, maybe, and awareness. Also, the stigma. And so I just think that makes it harder for individuals in Black communities to get mental health care.
I think that mental health care might be a little hard to receive in Black communities, mostly because when we talk to our parents, they might brush it off a little bit, or they just tell them that it's because of something else, whether it's because you're on the phone all the time or something like that.
But there wasn't always social workers, therapists, counselors that were normalized in the communities or very accessible as they are now in different places. Because there's more outreach, there's more actually things that are located closer to those neighborhoods, or there's more people that are willing to go back to those places and actually work with those students and establish themselves in the schools, so forth. There seems to be more programs that actually want to look at that.
Honestly, I have mixed feelings about it. I have some people who've tried seeking help, but then the people who they were seeking help from didn't really help them at all. And some people were they don't trust them.
So, I think mental health is looked at as being crazy, something wrong with you, and that varies depending on experience. I think that people have had with what crazy looks like. So the not having the label of being crazy is a big stigma.
Mm, Personally, no, I didn't grow up with a stigma about it. It was just kind of, if you have a problem, you just gotta deal with it by yourself, I guess.
For me personally, growing up, I didn't really think about it too much. I know most of it was media, just what I saw in movies or what I saw in TV shows. I didn't really think about it too much outside of that. I didn't really think about myself going to see a therapist or anything of that. I didn't really have a knowledge of therapy in general. It could have just not existed, and it wouldn't have affected anything for me. It wasn't until much later in life, getting more experience and getting exposed to more, that it became more relevant. But growing up, it was just I would see either a really good therapist or a terrible depiction of a therapist in media, and it was just that was my understanding.
And it was more from my grandma was, kids don't get angry or feel negative emotions, which made me even more angry. And then there was my parents who were they'd think I was overreacting.
Yeah, in a sense I do, because what we know historically is that minority, especially Black communities, have been suppressed and not allowed to access certain resources that can put them in a certain position in life. And so that creates stress. And what we know about mental health and mental illness is, stress is a huge factor in that. And so when you think about some of the biggest stressors that us as a society has, So socioeconomic status, physical health, relationship status, marriages or whatever, those things are really stressful in and of itself. And so as a black communities are at an increased risk for those type of stressors. So then, yes, they are at an increased risk for mental illness.
It could possibly be true because like over time we've been taught to think a certain way, and so we're like all used to that, and instead of bringing each other up, we just continuously put each other down.
So research, just what comes from it, and depending on who's doing it, it can end up creating a painting with a broad brush. It can apply to places where it doesn't. A lot of times that results in certain students even entering school being taught by individuals who already see them a certain way before they've even had a word or interaction. It creates expectations of entering jobs or just the interview itself to where, these individuals are just putting this certain expectation. And it's almost like, okay, you're working to debunk it. You're working to prove that you are smart, that you are, just aware of yourself and, can operate functionally, versus the expectation or, what's already set in front of you. It's not to say that people of color, that includes a large range of different diverse people, or more susceptible, I would say, I guess, to mental health issues, but those that aren't identified as people of color can also be as well. It just depends on a lot of things. It depends on upbringing. It depends on their values in life. It depends on their support network, because some of the most impoverished communities end up having some of the brightest people, some of the most amazing and influential folks. So it just, there's such a range to it. I guess that's the beauty of it too, though, in the relationships. But, it's also like these things that a lot of people have to fight against that aren't present for everybody. So it's an advantage and a disadvantage.
Partially, because there's some people who will be ignorant, and if something happens to them, they'll be like, it's because I'm black, isn't it? And I'll be like, nah, you just slow.
I think that people want to feel like there's a level of relatability. And unfortunately, I don't think we as a human race just identify on that basic element that we're all humans. And there are different categories that separate us. And so race is one of them. And that experience that comes with the race is another thing. And so as an individual consumer looking for, mental health services, I think that people look to someone who they feel may be able to relate to their own individual issue. And I think that is problematic because, again, at the core of mental health issues, it's all just, to me, like human imperfections that we're all connected by, and so we can all relate on that level. Now, individual experience is something else. That someone may be seeking. Like, I need you to be able to, or there's a higher chance that you will be able to relate to my own individual experience.
I think that there could be more because from experience, I remember one time I was upset at school. It was my freshman year and I would cry a lot. And one time my counselor asked me if I had a father in my life. And I kind of just stared at it because it's that's not even why I'm crying. It was just kind of weird. I feel like if it was an African American, they wouldn't have asked that because it doesn't seem important.
I think whenever you can diversify a field that impacts diverse populations, it makes sense. I think that allows it to be more dynamic. I think it allows for mental health to become more of a expected thing. An expected outlet to turn to versus an anomaly in a friend group, an anomaly in a support group, to where, a lot of people in that support circle could use the help, but not everybody is susceptible to it. Not everybody knows that it's available. Not everybody sees somebody they can identify with. So having more diversity, where there is more males, more females, more people of color, so forth, I think that's great.